Well, I get depressed, so if you would help me with the depression, and I've been...
In a clinical setting and performed by a licensed professional, acupuncture is effective for a variety of complaints. Amongst the colorful sights and sounds of San Francisco, I found the American College of Traditional Chinese Medicine. It was here that I met Dr. Liza Goldblatt, who says there are several problems that stand in the way of an integrated healthcare system.
One is ignorance, another is turf, and another is economics. The economics of our healthcare system, generally speaking, don't tend to support collaboration. So you might be seeing an acupuncturist, you might be seeing a chiropractor, you might be seeing a medical doctor, you might be seeing a naturopath. And this is when we get to the pith of my particular passion. Because so far in the United States with healthcare practitioners, we tend to educate practitioners in silos. They actually truly learn very little about each other. They might have one survey course about the other healthcare fields. So they by no means learn enough to know how to work in a team, either in a clinical team or in a research team or in an educational team. But there have now been 2 or 3 very good scientific studies that show when the doctors and other healthcare practitioners work in healthcare teams, the patient is happier, patient at the center of the medicine, the healthcare outcome is much better, and for some of the insurance companies, the best news of all, we lower the costs. So it's clearly starting to indicate that if we can somehow overcome these economic and turf and ignorance areas, then ultimately we'll have a much better healthcare system. And the way to do that is through education.
What is the most yin channel in the body? Kidney.
One of my colleagues says, when a patient comes to me with migraine, I first insist that she tries acupuncture. And if that works, great, and if it doesn't, I will then use Western medicine. To me, this is ideal medicine. You start with less invasive, and if it doesn't work, you go to more invasive.
In Seattle, Washington, I also met Dr. William Huff, the Director of Alternative Services at Group Healthcare. Dr. Huff is a Western-trained medical doctor with a particular interest in integrating complementary and alternative therapies like acupuncture into the medical community.
Acupuncture can be seen in a variety of ways, for example. It can be seen as a technique, as a tool. It can also be seen as a philosophy of care, a total treatment modality of health and well-being. One of the things that we're trying to promote in healthcare in general and wellness is that care is integrated. If you have a party out here, a party out here, a party out here treating a patient, there's no integration. They might be doing things that actually are counterproductive to each other or that don't help the other treatment. So the challenge is in how we bring those together.
But in 1995, Washington State passed a mandate that compelled insurance providers to cover complementary and alternative services. This important piece of legislation is closing the communication gap between the medical community and acupuncturists.
One of the benefits I see of Washington's mandate for providing alternative medicine services is that it really has sort of forced the issue of these varied disciplines, including standard Western medicine and acupuncture, coming together and being put in the same room. And I use that metaphorically.
You go.
So I think that the challenge for all providers is to have an open mind toward what the other providers offer and to begin to have a dialogue.
You know, if a patient has a sinusitis,
try and develop a relationship, because out of relationships you start to gain understanding, and that understanding benefits the patient.
Now we're at
Back at the American College of Traditional Chinese Medicine, I met with the president, Li Shenhuang. This is part of the garden?
This is part of the student garden.
We had the chance to sit down in the herbal garden, where about 300 different kinds of herbs are being tended by the students of the college.
For American students to learn about traditional Chinese medicine, they have to change their thinking. They have to understand this is not purely science-driven, what they learned in the past. It is a medicine with a long history. They have to understand yin and yang theory. They have to understand how ancient traditional Chinese medicine doctors think in those days. They have to understand all the seasons. They have to understand everything surround a person would have impact to a person's health. This is new to a lot of American students. They've never known about it.
The process of becoming a licensed practitioner at the American College of Traditional Chinese Medicine is very challenging and demanding.
Students would usually spend 4 years, 3,000 hours learning traditional Chinese medicine and Western medicine theories. Clinical training will take 1,000 hours with a lot of patient contacts. In classroom, students have to learn from their teachers. This is also different. Teachers bring classroom not theory, but a lot of experience they accumulated in the clinic. Another difference is they have to learn from the patients. They have to listen, they have to understand, they have to truly know how those patients' responses will lead and help them in diagnosis.
As students graduate from the college, the hope is that they will consider acupuncture as part of integrative therapy, to not only apply the theories and techniques of acupuncture, but also encourage patients to rely on Western medical treatment when it is indicated.
In China, traditional Chinese medicine is fully integrated. In the hospitals, you would see the practice of Western medicine and traditional Chinese medicine. The treatment usually is a surround for what's the best for patients. It's fully integrated. In the United States right now, we are not integrated fully.
While acupuncture is effective for many types of problems, there are certain people who make better candidates than others for the therapy. These include patients who have tried more familiar therapies without success, particularly for a chronic or recurring problem, someone who is reluctant to endure the side effects of some more conventional Western therapies, and someone who wishes to emphasize wellness and prevention over the disease model of medicine and is willing to make lifestyle changes to achieve optimum health.
Many times, or very often, patients would come to acupuncture or traditional Chinese medicine as their last source for help. And people learned what acupuncture, traditional Chinese medicine can do for their health care. That's why it is recognized by patients, by doctors, by the public, by hospitals, and by researchers.
The majority of the patients for acupuncture in Chinese medicine